Hello everyone, good morning. Today let's learn about gout. What do you mean by gout? Gout can be defined as a type of arthritis due to increased uric acid levels. It can also be said as deposition of monosodium urate crystals in synovial fluid and surrounding tissues characterized by joint pain, redness, erythema, swelling, warmth of the joints. This is what gout. So, Uh, what do you think are the main causes for gout? We know that gout is a disease where uric acid levels increase in the body and that causes redness, joint pain, swelling, erythema, etc. So, what are the causes, main causes for gout? What do you think? Let's see what are they. The etiology includes first is age. For men, this will be between 30 to 50 years, and for women, it will be after postmenopause most probably. And second one is family history, diet. In the diet it consists of two. One is increased alcohol consumption, which increases body's uric acid levels, and the other is high purines diet. Next is obesity, and then medications. Some of the medications causes side effects such as increased uric acid levels in the blood or serum. The other is medical conditions, that is comorbidities, where conditions like diabetes, untreated hypertension, metabolic syndromes, heart diseases, and kidney diseases may lead to this. And the other are enzymes, where it can be said as deficiency of enzymes such as hypoxanthine, guanine, phosphoribosal transferases, and PRPPs, etc. So, what do you think the main reason for gout? What causes it? What is the pathophysiological reason underlying this? So, yes, of course, it is either due to excess production of uric acid or under excretion of formed uric acid. That is, either there might be increased uric acid production in the body or else decreased elimination of the already formed uric acid in the body. So, let's just see an overview of the pathogenesis of gout, how it occurs. So you can see on the slide, first one is under excretion of uric acid, that is decreased elimination of uric acid, and the second one is increased production, overproduction of uric acid. These both conditions leads to elevated uric acid levels, which in turn causes formation of urate crystals, and those crystals interact with the inflammatory system causing acute gout. So there's a lot more to discuss about the pathophysiology of gout, but as this is just an overview of the disease of the gout, this is the overall pathogenesis which occurs in the body. And let's see what are the clinical presentations, what are the signs and symptoms we can see in the patient suffering with this. First is rapid intense pain, swelling and inflammation, which usually affects large joint of big toe, and these can also be seen in feet, ankles, fingers, knees, wrist and elbow. And we can also see a symptom of swollen joints, warmth of the joints, redness, leukocytosis, fever, and the pain will be more at night and early mornings than throughout the day. It will be throughout the day even, but still it will be more at nights and early morning times. Here in the slide you can see the picture of the gout disease. On your left side, here you can see the affected big toe which is affected with the gout, and on the right side the knee which is affected with gout. You can see the redness in the pictures. Yeah. And next, now guys, I'm having a question for you. How can we soothe or get relaxed from the symptoms apart from using medications? Is there any option for us? What do you think? And the answer for that is yes, of course. Maybe not completely we get rid of the disease or the illness, but still there is a chance of getting soothness, no, getting soothe of the redness, warmth, joint pains, etc. What do we do for that is frequency of reoccurrence and chronic sequel may be reduced in some patients by initiating non-pharmacological treatment. Now, what do you mean by non-pharmacological treatment? It is nothing but this includes our lifestyle modifications, our dietary changes, our physical activity, etc. So let's see what are those. Some of the lifestyle modifications are dietary excess. So these will result in acute fluctuations in serum urate. Second is weight or BMI. We can consider these in obese patients who are overweight. So decreasing in weight or weight loss can help them improving insulin sensitivity. So that will decrease insulin resistance and serum urate uh, simultaneously. And next is alcohol. Decreasing alcohol consumption will result in decreased uric acid synthesis and improved renal uric acid disposition. So these are the non-pharmacological treatment which will help us to get rid of the symptoms at least to an extent apart from pharmacological treatment. So now let's see what are the pharmacological treatments. In pharmacological treatment, we are supposed to use NSAIDs, corticosteroids, xanthine oxidase inhibitors, uricosuric agents, and urikolytics. Let's go deep into them. Uh, Xanthine oxidase inhibitors. What do you think they do? How they are gonna help us to to treat the disease? Xanthine oxidase inhibitors, they do decrease uric acid. They do reduce formation of uric acid by inhibiting conversion of hypoxanthine to uric acid. And next comes uricosuric agents. What do they do? Uricosuric agents, they increase uric acid excretion. They improve the elimination of the formed uric acid which is present in our body already, which is formed already. They improve elimination of the uric acid formed in the body. And next, urikolytics. These agents like polyethylene glycol, etc., they reduce serum uric acid by converting the formed uric acid to allantoin. So this is how these medications, these drugs help us. I hope everyone are clear with the mechanism, how they work. So yeah, these are the drugs, how they help us. And sometimes in the patients who are contraindicated with NSAIDs, we do use colchicine to treat them. So yeah, this is an overall overview of gout. Hope you guys have enjoyed the session. Thank you guys. Thank you so much.